Well, this week's Wellness Wednesday takes a look at something we all are probably suffering from, back pain. And we are delighted to have with us Dr. Jason Stacy, a neurosurgeon. How are you doing, Dr.
Doing well,
Stacy?
thank you for having me.
And thank you so much for joining us.
Sure.
So, back pain, you brought my
That's
back.
right.
Tell me, what is going on?
That's right. So everybody knows what arthritis in the fingers or the knees feels like, and it's the same in the back. The most common cause of back pain are these joints running up and down your spine that we all can feel, and it's the most common reason our backs hurt.
Wow. Okay, so you're saying primarily arthritis and joints. When
In
you
the
say
joints. Yeah, that's right. So every vertebral body has a joint, and they hold the back together. Most people feel like the discs are the problem, but by and large, the joints, the arthritic joints, as we live, as we work, they degenerate as long as we're living, and so over time, back pain just becomes more prevalent.
Okay, and when it comes to symptoms of back pain, how can one differentiate between what is a back pain or something else like a kidney stone causing that kind of a pain?
You know, typically it's location. Back pain that we think of as isolated back pain is in the middle. The kidneys may be in the side, other parts of the body may have pain for other more severe causes, but for back pain of the common reasons we're talking about, it's just really in the middle of the back, sometimes going even across the lower buttocks, but typically not further.
Okay, and we have up here stiffness as well as aching, if we can go back to that. Tell us a little bit
That's right.
about those other symptoms.
Yes, well, you know, once there is pain involved, the muscles reflexively spasm, and so it's extremely common to have muscle spasming secondary to back pain.
Oh, okay, and then?
And then buttock pain, that's right. And in and of itself, all of the muscles of the lower back and the buttock create pain, so it sort of creates we call it a feedback loop. So the back pain creates muscle spasms, which in turn worsens the back pain.
And when it comes to treating back pain, what are some of the recommendations?
Well, the most common thing is to take it easy for a short amount of time, to modify whatever activity caused it, injury, work-related, ergonomics, etc. But really importantly, physical therapy, acupuncture, dry needling, and some common over-the-counter medications like ibuprofen, Motrin, the other various anti-inflammatories. Those are really the mainstays and time. They typically goes away with no intervention at all.
Okay, and then what is radiofrequency ablation?
Sure. I think the concept that shots fix a back is kind of a common misconception because what we need to do is treat the joints that are arthritic that we were talking about. And so radiofrequency ablation, after we prove that there is a joint involved, we take a little probe that goes right under the joint itself, and it heats up essentially and creates the ability of the nerve that had previously been hurting to not hurt any longer.
All right, then. Well, thank you so much there, Dr. Stacy, for joining us.